diabetes have its very specific complications,
Yes.
which I mentioned from head to toe.
Yes.
And in between, management of your diabetes is education and instruction. If you know what you have, you'll appreciate what to do.
Okay.
If you don't know what you have, you don't know anything about it. As you see, some people say, I feel good, and I don't take my sugar tablet because I feel good. They don't understand what it is. That you may feel good, but your sugar may be high.
Okay.
People who are associated are people who are into healthy groups
Yeah.
will live 5 years longer than people who are by themselves.
Okay.
And so because you can get encouragement. If take your medication and just don't stop it unless you have good reasons to stop it or modify it.
In Office with Dr. Jevon Samuels.
Another episode of In Office. I am Dr. Jevon Samuels. In office with me today is Dr. Lorenzo Gordon. He's a consultant internist and also diabetologist.
Yes.
Welcome to the show, Mr.
All right, good, thanks.
Good. So today I'll be discussing everything about diabetes. So my guest here actually specializes in diabetes and also does his own research with diabetes patients. So it should be an interesting discussion and you should be able to learn a lot from this discussion today. Dr. Gordon, right?
Yeah.
What is diabetes and how does it normally affect the patients?
Well, diabetes, in fact,
Yes.
is a metabolic disease.
Yes.
And in fact, it affects all organs of the body.
Okay.
In fact, it is a little notation that is common in the medical circle that says many of the professions
Yes.
in the medical, sub-professions of the medical circle claim diabetes. So some, the cardiologists say, diabetes is mine because diabetes affects so much of the heart diseases.
Okay.
And some persons who are, nephrologists, kidney doctors say, diabetes is mine because so many people who have diabetes end up having kidney problems.
Okay.
The neurologists say, don't leave me out because diabetes affects the brain so much.
Okay.
Then of course you cannot leave out the ophthalmologists who say diabetes is mine.
Okay.
But don't around the corner, the skin doctor
Yes.
also said, listen, diabetes affect us.
Okay.
But then the surgeon said, no, it is very serious. I do a lot of amputation and I have to do temperament, all of that.
Okay.
When the diabetic foot is affected, just a little part of the foot and it blow up and I have to do amputation. So the surgeon, the orthopedic surgeon say, diabetes is mine. So in other words, diabetes also affect other areas of medicine. So the psychologists also say, diabetes is mine because many people who have diabetes cannot adapt to the lifestyle changes and sometimes they need help to understand first the diabetes and how to adapt to this, disease. Then of course you have the educators who now specialize in diabetes, who said, listen, this is very important. Why many diabetics are not successful? Because they are not fully educated. So we have another area called diabetes educators. But then don't leave out the physiotherapists.
Yes.
Not in many areas, but in some places in the world, it forms a very important part of the management of diabetes, because all of that diabetes is going to affect your entire being and your peripheral, the disease of the feet, the disease of the heart and all of that. So you need to keep moving, exercise. So there are people who specialize exercise for diabetics.
Alright, but since you have to give a brief summary that it affects all the different organs in the body, so what is diabetes in itself?
In itself,
sugar levels and so forth.
Right, so diabetes is not just sugar. Maybe for the simple layman, it is sugar. But as I started off, it's a metabolic disease that affects all of the area. And I mentioned, just to doubling up, all of the area of specialties, but in other words, it affects so many parts of your body.
Yeah.
So that's the important thing. But it is a disease that affects the pancreas essentially.
Okay.
And what the pancreas is that organ, and for patients, and so especially younger patients,
Yeah.
I would show them where the pancreas just, and
Okay.
they can touch it and relate to it. When I
Okay.
say diabetes is a disease of the pancreas, and it is some aspect of it, the pancreas is sick, not producing enough insulin.
Yes.
But truth be told also, some types of diabetes, you may produce some amount of insulin, but the insulin is not effective.
Okay.
So it can be defective, the insulin that you produce.
Okay.
But let us say in a simple way, it's a problem of the pancreas,
Yes.
and it's a problem of the insulin. So the insulin has very important role. It
Okay.
helps just like a regulator of a regulator in a fridge.
Okay.
It tells you how to adapt the temperature. So the pancreas and the insulin adapt the blood sugar in your body to arrange. If the sugar is too low, you have problems.
Yes.
Because two important organs that will be affected critically
Yes.
when the sugar gets low or too high within the brain
Yes.
and the eyes. The blood vessels, they are very small, in other
Okay.
words. Of course, so diabetes being very important, that if it is low, but of course if it is too high,
Yes.
it becomes a problem.
Okay.
For many persons, diabetes being high, it doesn't seem to affect them that much.
Yes.
When it's low, you will definitely feel it.
Yes.
When it's high, for some people, it may not affect them.
Okay.
But later on, if it keep high, it
Yes.
causes all of the complication from, we say, head to toe.
Yes.
And so there is, I must tell you, although we say it's a disease of the pancreas, disease in which the pancreas is not producing essentially very little or no insulin at all, and the insulin is such an important hormone, that
Yes.
help to regulate the sugar and keep the sugar at a certain level.
Okay.
If it goes down too low or too high, it's going to cause all of these complications. That essential, simple way of understanding the diabetes. And therefore, the real truth is to be able to keep your blood sugar within that range, not too low and not too high, for you to be able to function very well.
Okay. What are the different types of diabetes? For some persons may have type 1, type 2, but they have additional subtypes.
Yes, you have many different types of diabetes, but for the simple man, and let us not go through too much, we may say in a simple way that diabetes may be of 3 types. We have type 1, which is what we say when there is no insulin at all.
Okay.
All right, and that's called type 1, and that usually present in the younger population.
Okay.
However, of course, the older people can start with type 2 and then they move on to type 1.
Okay.
And then of course you have type 2, in which they produce some insulin but not enough to be able to take care all of the function of the body.
Okay.
Then you may have what some people say, the layman say, a touch of diabetes,
Okay.
or what we sometimes technically say glucose intolerance, and so forth.
Okay.
And that is a patient who is not fully diabetic but not fully normal, and there are many reasons why that can happen.
Okay.
Of course, within that or close to that, there may be persons who what is called having pregnancy-induced diabetes, and there are different subtypes. That means you develop diabetes during pregnancy, either just before, during pregnancy, or just after pregnancy, and that in itself has its own kind of problem. And if it is treated in the proper way, you may not develop full-blown diabetes later on. So there are many other variants of diabetes, which may be related to malnutrition and other aspects of it. But for the purpose of this discussion, let us keep it simple.
All right, good.
In that way.
All right, so this program is basically for the general public. So what are some of the symptoms that persons normally present with diabetes, especially when they're newly diagnosed? Or
I want to be able to tell you that from our indication, we say from the International Federation of Diabetes, for example, IDF, and the many other big bodies do say from data that the 50% of the people who have diabetes today, there are 50% who are diabetic and don't know that they are diabetic. So it's very important. And so it is important that if you have a risk, you may have diabetes and you don't know, because you may not really have the symptoms. So sometimes, for example, if you, for example, I give you this as risk. If your mother and father, for example, have diabetes, your chance of having diabetes sometime in life is going to be about 95% that you will develop it. So it may take a few years. So in fact, if mother and father have diabetes, you should almost start to treat yourself by having lifestyle modification, which we can talk more about that. And of course, there are certain risks that you may have to check to see if you develop diabetes sometime, because you may not have any symptoms. So for example, people who sit down a lot and they develop obesity, and certain people have taken certain type of medication. For example, let us say steroid, for whatever reason that they are taking steroid, whether it is for treat a particular disease or so. And people who have severe infection, for some time they may be admitted to ICU, motor vehicle accident that they have to be in bed for a long period of time. People who have certain kind of disease like what we say trisomy Down syndrome. All of these people are at high risk to develop diabetes. So risk is very important, because in all of that is another 50% of those people walking around and don't have any symptoms. But if you have symptoms, then you need to check it. Or if you are diabetic and you start to have symptoms, it means that your diabetes is uncontrolled. So as you asked me, I need to tell you about risk, but I will tell you about the symptoms too. And some of them, it is said, for the diagnosis of diabetes, if you have 2 or more of the symptoms, where you may have excess thirst, for example, excess urination, you have a sore, some itching that is persistent, then you could have symptoms. Of course, if you're feeling down, you're feeling lazy, you're feeling you're losing excess weight, so these are some of those notable signs or symptoms that may say that you have uncontrolled blood sugar. That means you may be diabetic and uncontrolled, but it also point that you're not diabetic yet, but having these, then you may develop diabetes. And especially, as I say, if you have risk is very important. So if your family risk all of that, and you're taking medication, or you're laid up for some period of time, or you're not exercising, and you're eating excessive some amount of sugar. For example, we have seen when we had the sugar factories in Jamaica, when it was more abundant, you found, the research that are published in Jamaica show that around the sugar belt, there were more people with diabetes than outside.
The research was done in Jamaica?
Yes, actually published years ago, that when they looked at the people around these sugar factories, because oftentimes they would consume more sugar than the regular, because of the availability of some form, whether they get it you know, because they're working in the sugar factory or so forth and get cheaper and they consume a lot more sugar. They found a higher incidence in those persons surrounding the sugar belt. Of course, we don't have so much of the sugar factories around, so we're not seeing that, but that study was actually done. And so.
Alright, so it's for the general public now, you're saying that 50% of persons with diabetes don't have any symptoms, or asymptomatic. So what are some...
And they're walking around.
Yes, so what are some suggestions that you would make or steps that they can take to screen for diabetes?
Well, you know, as I mentioned, for those persons who are at risk, and I mentioned outline the risk, family history, high family must get a check whether, I mean, if you can't afford, for example, a blood test, and it's not convenient, maybe even a urine test is a simple way that you can check, and you see a spilling sugar, it may propel you now, push you to go to the clinic and say, or it's cheaper to do a dipstick, and if you're afraid of blood, to take, you know, an injection, so to speak, and take your blood, you may be afraid that you can ask, can I check my urine? And if you see something there, of course I'm not saying that is the important test, but people at risk, then that is a very cheap test to do. That's something, if you have risk, then you can do it. Of course, as I mentioned, if you're having 2 or more of these symptoms, you're having excess weight loss, you're having thirst, hungry, and you are urinating very frequently when it's day, and you have to wake up many times at night, then and you're losing unexplained weight loss. Those are something, or you get some itching, are you getting recurrent infection, a simple infection, you know, you're getting urinary tract infection recurrently. These are things that you will look at, or you get a little sore, and you're just not getting better. Then you need to really look at that.
Alright. Now, diabetes, in terms of the diagnosis, what are some of the different, I know I said the urine was just for screening, but what are some of the tests that they use to diagnose diabetes currently? Alright.
For example, some of the renowned tests are diagnosis criteria. We must state the golden rule is called the oral glucose tolerance test that is established. That is the premier test, first important test. And this, of course, sometimes it's a little bit more challenging a test to do, and not everybody can afford it. And it's challenging because you have to, like, overnight fasting, all right? So from say 10 o'clock the night before, you don't eat anything, and you turn up in the morning without consuming anything at all to a center between 7 and 9, not before 7 and not after 9, because of the criteria that determines that. So you turn up and they first take a blood test. They can do a urine too. They take a blood test, and they can check first your fasting blood test, and they record it, and then so they get a result. So that result can be higher than a particular range. And some books, some persons will say it's between 3.5 to 6.5, or for some literature is 5.5, depending on the lab. So that range is there as the fasting. And at the same time, you may check your HbA1c. That is a test that determines in the last 3 months how bad your blood sugar is. And this is based upon how much sugar that is bounded to the red blood cells. And so we have that criteria. Then we give you 75 grams of glucose. So what we're doing, we're challenging your pancreas and see how it responds. So you drink that, and then now we take your blood sugar every half an hour for 3 hours. This is a classical, and then we can then determine on a plot of a graph the normal value versus the abnormal value.
Okay.
And then it tells you many things. Very simple. If it is way off the scale, we say clearly you're diabetic.
Okay.
And then we want to confirm it, we can do this other test, which is HbA1c, that many diabetics hear about it because it's a single most important prognostic tool to determine the complication of your diabetes in the management of diabetes. So that test is the oral glucose tolerance test. It's the gold standard of determining if you're diabetic or not. But there are other tests and criteria. So for example, if you do a random test, so you're feeling sick and you're having excess urination and you are too weak and you can't go tomorrow morning to do that test, but you turn up to the doctor's office or to the hospital and they do a random glucose test randomly. Doesn't matter, they don't have to ask you when you had eaten the last meal, so they just do it. And if it is now greater than 11, and the unit is that I'm quoting is the unit that I'm referring to is of course a standard unit, right? International unit, right? And not the old unit like that the United States uses, millimole per liter. So if it is greater than 11.1, that's greater than 11. Random, plus you have 2 or more symptoms, then the doctor can determine, and using those values, can say that you are diabetic and start to treat you. Of course, there are other criteria that can be used, but those are the 2 established criteria. But of course, having risk and help you to do these tests will determine. Of course, with those tests, if you're unsure, you may then repeat the test again, and then you can follow the persons and so forth. Or sometimes, I must say that there are persons who have abnormal reading and they settle down. So nothing is written in stone. But then again, once you are found to be diabetic, it doesn't stop there. It doesn't mean that just those tests alone. We have to look at the complication of the diabetes. That's very important. So although we say you're diabetic, it doesn't stop there. Although we say that you must start medication, it doesn't stop there. Because diabetes have its very specific complications, which I mentioned from head to toe, and in between, which mean diabetes can affect your hair. So diabetics lose their hair easier. Diabetics, if you come right down the line, diabetes affect the eyes. Diabetic, also the dentist. Don't forget the dentist in this. Diabetic will have gum disease more than anyone else. Diabetes is associated with thyroid problem too. One particular type of diabetes, right? We won't go which one of those, but diabetes that have some relationship with autoimmune disease that affect the thyroid. There is also the same antibodies, right? That's something in the blood that will destroy the thyroid and destroy the pancreas. That is also a connection. So it affects diabetes affect the heart. Diabetes affect the kidneys. It affects your sex organs. So many diabetics do have dysfunctional sexual problem. Then diabetes affect the limbs. You get sometimes that is, in fact, some of the early stages of the problem, persons start to get numbness, get tingling sensation, and then before you know it, they lose the sensation in the leg. So having the pain and the sensation, it only gives you an idea that diabetes is affecting the leg. If after a while you stop feeling the leg, they are in trouble. You may say the diabetes is no longer a problem. That's when you're in problem, when you stop feeling, because that's when you have a greater chance of losing your leg when you stop feeling it.
Okay.
So those are some of the complications of diabetes affecting every part of your body. So this is why, having understood that diabetes can affect every part of your body, when you're diagnosed with diabetes, even from day one,
Yes.
you must check these organs, especially if you have type 2 diabetes. And at the time of diagnosis, oftentimes when you're diagnosed with type 2,
Yes.
that means the adult onset diabetes,
Yes.
you may have, from studies, show that you may have had diabetes for 5 to 10 years
Okay.
before you're diagnosed on this particular day.
Okay.
So what it means is that your eyes may start to give you problem from that time. Your kidneys may be in trouble by the time you're diagnosed.
Okay.
So what it says is that at the time of diagnosis of your diabetes, oftentimes you may start to have complications. So you have to do some of these tests. So it's not just start your medication, it's to see where you are, to make sure we check your eyes, check your kidneys, check your heart, understand? And put you on a program. And it's very important. It's not actually the most important treatment of diabetes. It's not medication.
Really?
No.
What is it?
Let me explain. Let me explain. They are, and I see a lot of patients.
Yes.
And the ones who think that medication is the only treatment for diabetes, they're not as successful in terms of managing their diabetes as compared to the one who understand what diabetes is.
Okay.
And according to the authorities in diabetes, diabetes have 5 pillars of management.
Okay.
And in fact, depends on how you look at it.
Yes.
Some, they say, and of course, the approach must be in this order.
Okay. What did you go ahead?
So the order says, the first management of your diabetes is education and instruction. If you know what you have, you'll appreciate what to do.
Okay.
If you don't know what you have, you don't know anything about it. As you see, some people say, I feel good, and I don't take my sugar tablet because I feel good. They don't understand what it is. That you may feel good, but your sugar may be high.
Okay.
So understanding the disease, understanding the symptoms related, that sometimes you may not have any symptoms at all.
Yeah.
And your diabetes and your blood sugar may be high. Of course, when it's low, you're going to know.
Yeah.
But the problem is when it is high, you may not feel anything, but your body has been destroyed.
Okay.
So being educated, and that's why I use education and instruction, because you may understand it, but you don't follow the instruction.
Okay.
That's why I put that together.
Okay.
Some books just say education, I put education and instructions, because what it means, you understand and you are instructed and you're following the instruction.
Okay.
So that is, for me, that is the most important thing. Of course, within the diabetes education and instruction, it says that it brings in the other part of the management, because instruction meaning that you may then, depending on which country you are,
yes,
and depending on your resources in your hospital or in your community,
yes,
you may have a diabetes educator,
okay,
or you may have a psychologist,
okay,
who help you to understand and follow the instruction. Or if you don't have these, the other set of people who help you very well would be your family members.
okay.
If your family members understand what diabetes and able to check you and remind you, hello, did you check your blood sugar this morning? Hello, when last you went to check your eyes? Hello, when last you went and check your blood test? All right, hello, why are you wearing that pair of shoe? You know, afraid of getting a sick and you lose your foot. So you see, so the indicators don't have to necessarily be the established form educators, but they can be the family members, can be also friends and relatives who are there supporting. So that's very important, and I emphasize, to me, that's very important. It motivates you and push you to understand and to comply. So when you lapse, you say, did you take your medication this morning? So it's not just educated, it's the instruction. The next important thing, it is diabetes, diet. Diet is important. Now, these are all a big thing about you have to have all of these restricted diet and a diet sheet. In the new paradigm of management of diabetes, we don't go with a diet sheet anymore. We now do a personalized diet for the individual. It's more successful. Why I'm saying that? It based upon what you can afford. It depends on what you like, which of course there are many factors. Where you live, how much your income. So what you do for the person is to say what you can afford, and you target your blood sugar based upon what you must eat. So if, for example, you are eating 3 dumplings in our setting in Jamaica, and your blood sugar is high, not to say that you should eat the 3 dumplings, but you cut from 3 to 2 and say the sugar along with the medication you're taking, adapt. But then you're going to be hungry because you're eating 3 dumplings, and that's normally. So you then say, all right, with the high carbohydrate flour content of the 3, I'm cutting it to 2. The other 1, I'm going to substitute to bulk me up, to give me that energy, that feeling. Because if not, you are going to tell lie on yourself, because you're going to steal in the fridge to fill that. So you have to substitute now. So you take, for example, a piece of yam, understand? To substitute for that loss of that bulkiness of that carbohydrate. So you understanding the person, and the person is motivated with substituting for that extra bulk or sugar that he or she needs, can balance it. So this is why diet is important, and you just don't go for a diet sheet and ask people to buy things that they can't afford. They can only sustain that for a short time, and that's why the diabetic diet must be personalized based upon many factors, your income and what you like, man, your cultural likeness. Now you want to be happy, so if you can adapt your food, and your food can be your medicine, it's going to be good, because when you eat and you like what you eat, you're feeling better, and that will keep you healthy. The third important thing also is going to be your exercise. So we say blank, all diabetics have a risk of dying from cardiovascular problem. And so we must help the diabetics from dying too early. So they must exercise. So we recommend at least 15 to 30 minutes of exercise every day, rain or shine. We also say you don't have to do expensive exercise. You don't have to buy gym equipment at home. You don't have to go to the gym. You don't have to go out on the road jogging. You don't have to have a yard space. If you are in an apartment, it is movement. So we use the word movement. It is a physical exercise that you're moving your entire body, whatever your ailment. So saying that in a general way, what it means is that if you're in a wheelchair or you're in a bed, you can still exercise, because you're moving your body relatively based upon your individual ability of your own function. So you have no legs, then you can't do jogging, but you can be in your wheelchair and you move your upper body. All right, so it must be adapted to, and that's why it is stated, move your body continuously for minimum of 15 minutes. But then the way you start like what medicine does. Titrate. You start slow and go up gradually.
Yes.
Start small and increase. That's the rule of medicine. That's the rule of life. Don't start big. Start small. You start with 2-3 minutes a day, then go up until you reach a 50. Don't start 15 the first day. You may not sustain it. And if you start too much the first day, you're going to discourage yourself because you're going to have pain and cramp and you're not going to continue with it. So exercise and how to do it is very important. The fourth one is monitoring. It is important to monitor. Now, in our days, of course, living in Jamaica, we get a lot of support from the National Health Fund and other places that people can get their glucometer machines, and if you can't get it, you will know when you have an association of some sort. You have people who go to similar clinic in your area, friends or relatives who know you, and you talk about that. In fact, I must tell you, as part of lifestyle changes and how to live, they state that people who are associated are people who are into healthy groups will live 5 years longer than people who are by themselves. And so because you can get encouragement. If you go to a clinic and you find friends, may not be relatives, because you may not have other relatives who are supportive and who are diabetic, but you may find somebody maybe near, maybe neighbors, or maybe far that you can, everybody have a telephone now, that somebody can talk to you about your diabetes and help you along. And if you don't have a blood sugar machine or you want breakdown and so forth, and you can't get the strip, somebody may be able to lend you a strip and you can check your blood sugar. So monitoring the fourth point is important, so you can see the medication is working. And of course, you can't wait till you come to the clinic, because, for example, where we work at KPH, sometimes we can't see a patient so regular. We can't see the patient every month. Sometimes it's every 3 months before we can see you. The clinics are too large, so you can't wait for the next 3 months to check your blood sugar. You have to find some way, and you bring those readings, and we can look at it and give and adjust your medication the right way. So monitoring is important. Of course, monitoring is going to be checking everything else. Did you go out and check your eyes? Let me check your kidneys. Let me do your ECG. That's all about monitoring the food. And then the fifth one is taking the medication. And that's where medication comes. Because here's the trick. If you do all the above, you will appreciate your medication. You also will reduce the amount of medication, and in some instances you may not have to take the medication because you're in control. You're doing exercise, you're doing your diet good, you understand what it means, you're doing your follow-up. You may in some instances require less medication, and in some patients may not need medication if you're having proper diet. Of course, for type 2 diabetes, not type 1, I must say, for type 2, because it's a lifestyle also. Whether it's lifestyle direct or lifestyle indirect, meaning that lifestyle modification is going to help you in any way, in every way.
Alright, so well said. The management is a clear-cut understanding. Medication is not the most important, but you have to do the rest of it.
Yes, of course.
Right? No, in terms of, can differ away from management a little, talk about some of the diabetic emergencies. Right? Because some persons might present like, coma or decreased responsiveness. So what are some of the diabetic emergencies, and what are some of the signs that the patients or persons in general could look out for?
Well, the truth is that, diabetic emergency can be very serious. So being diabetic, you have to relate now to the risk of your own job. So what it means is that you have certain risk that is associated, occupational risk being diabetic. So if you're driving your car or you are using heavy equipment, whether heavy equipment like people who have using cranes or people who have machines that are serious, are people who are divers and they are diabetic. These people are at high risk. So what it means is that they, for example, must be strict about taking their medication. They must know their body, and they must also feel what is going on before it happens. If a person who having all of these risks and realize something is happening, right, that they are not feeling well, they should stop and get checked before complication sets in.
Okay.
So when you have these symptoms related, you start having frequency, you're feeling weak, you understand?
Yeah.
You're feeling too much numbness, you feel lack of energy, you start to have a fever.
Yeah.
Then you have to stop if you're diabetic, because you don't want to get into a diabetic crisis. And the diabetic crisis can be of two types generally.
Yeah.
One, you can go into hypoglycemic, that means low blood sugar crisis, let us say in a simple way, in which you can become confused. So imagine anything you do, you become, even if you're at home and you're confused, you can get up and walk out on the street. Or if you're living upstairs, you start to walk, try to go and you fall.
Yes.
So those are some of the things. So you must, and if you're monitoring or you start to feel that something is happening, then you stop, and before the crisis happens, you get checked. But if you are in a hypoglycemic episode, I mean, you probably, if you lose that control, if you understand what is happening before it happens, you can save yourself.
Oh.
But there are some people who frequently go into the hypoglycemic, I mean low blood sugar episode, that they don't know, they lose that control.
Yes.
Right? So they don't even know. But at the beginning they may know, but if they continue to not observe it, they will lose that control over a period of time.
Okay.
But on the onset, if you realize you're going into low blood sugar, you can get yourself personally out.
Okay.
But what is important is people around you should know that you are diabetic. So if you're at school, your friends must know, you must tell your teacher. You may be proud, or you may feel that you shouldn't tell everybody that you have it, but it's good to tell somebody, so if they see that you are not behaving in the way you're supposed to be, they must rush in a setting and give you something sweet.
Okay.
Now, you may say, suppose your blood sugar is high, and they give you sweet, nothing is going to happen, it's already high. But if it is low, right, and you don't have a machine to check, it's not going to cause any extra damage. So if you start to get confused and you're diabetic, get something sweet. If in a few minutes you start to, so respond, you start to be okay, then it means that you're low sugar. If after a few minutes you realize you're still confused, it means that your sugar is actually high, and they need to get you immediately to a place before you get worse. That is a simple way of responding and knowing yourself, and you must tell people around you who you spend a lot of time, that if these things happen, this is what they should do for you.
Okay.
Now, of course, you have, when you are in these crises and you lose control, that means you're not so sure, it is the other set of people who is going to take over your management.
Yes.
So they're the people who are around you, may not be nurses, they may not be doctors, so they must also know sometimes what to do.
Okay.
So the first thing, of course, as I say, give you something sweet. If you start having seizures, because you can have fits, so they say call it seizures. If your blood sugar get too low, of course, you get too high, you can still have that kind of crisis too. And you get confused and you start to do erratic things, almost as if you have a psychosis, and get out of control. They should know how to approach you, and like anything else, get you to a treatment center in the earliest possible moment before it gets worse. And some of the things is that if you get a wound, don't wait. Right? You get a wound and you're diabetic, seek medical attention first. immediately once you get a bruise or a cut, even if you get a bruise and you watch it and you clean it off, if you understand what you're doing and you see it not healing, or you see it warm, or you feel it warm,
Yes.
or so redness, so as they would say, I seen it, you seen
Yeah.
it like that, and you feel it, or you see it getting worse, then you rush to get some advice or to the nearest clinic or doctor, because if you wait too long, you can become complicated.
Okay.
But as I said, when you go into this coma, whether it's low sugar or high sugar, you have no control. The people around you must be the ones who you must instruct. Should I be in that state, please get me help immediately.
Yes.
Don't, after you administer some sugar and you see that I'm not responding, get me
Yes.
out to somewhere. You know, those are the kind of things. If the person starts to vomit, you know, just don't continue to try all of the home remedies.
Yeah.
Go straight to a center. All right. Our persons start to get confused, are having seizures. Don't usually the usual home remedy, taking a shoe and put over the face. All of those are fine. I'm saying you should practice those, but being, you know, either high or low sugar and having these things.
Yes.
It's not the regular kind of seizure you're having.
Yeah.
This can lead to other complications such as brain injury. So when you on your way, you can put the shoe over, or you can rub up the pepper leaf.
Yeah.
You can probably do all of that, but still get the person out to the near. Whilst you're rushing the person, you can try the home remedy. Not saying you shouldn't,
Yeah.
but for the diabetic getting into all of these states, you know, the home remedy is not going to work.
Yes.
You need to get once a complication set in to a state in which the patient can be rescued.
Yes.
And I use the word strong rescue, meaning that treatment can be applied immediately, if not before.
Okay. Alright, I know one of my questions was supposed to be to discuss the different complications of diabetes, but you have basically covered all of that earlier. But I just wanted to ask you, like, what is the costs behind some of these complications, like the cost of the patient? Because I know not every, for example, like with kidney failure patient, it's not everyone's gonna get the free dialysis, you know. So sometimes, I like to do this channel, education-based, medical information-based channel to discuss like the complications of some of these chronic illnesses and the costs behind them. So what are some of the costs that we're looking at with some of these complications that I discussed earlier of diabetes?
You know, one of the important things I usually say to my patients, don't think about the monetary cost. Look at the other costs. Look at the family, look at the psychology, look at the other costs. So when you look at having any of these complications, get a heart attack, you become less able to carry out many of your functions. You're not able to complete your tasks at work effectively. You're not able to go to places and do things, so you want to avoid those complications. You get into kidney, which is very high. You know, lots of patients at dialysis have diabetes. One of the, you know, the popular, you know, cause for kidney failure and dialysis is having diabetes. So the cost is not just monetary cost. It's going to be both psychological costs and the social support cost, that every 2 or 3 days you have to spend 4 hours at a center. Understand? Of course, you could say you can have home dialysis that is limited in our setting.
Yeah.
Only few persons do that. Most often time you have to go out to a center 2 or 3 times a week and spending 4 hours each time. That's a big chunk of your life there. And then, of course, when you are in dialysis, which is, mind you, a life support, great support, but you will have some effect on it. After dialysis, sometimes you have symptoms related. You may feel weak, and so for some people, after dialysis, they can't continue working. So you really, not just the money, of course, dialysis is expensive. Heart failure medication in the effective treatment is expensive. The procedures that need to be done to support you and all the tests, these are expensive. So what you want to do is avoid the complication. So once you're diabetic, it shows that you control your blood sugar within those ranges that we suggest as your doctor and your other supportive health personnel, whether the diabetic nurse, the people at the clinic, your own family members giving you the support to control. You're gonna have less complication. You will maintain good eyesight. You won't get a stroke too early. You won't get a heart attack. You won't get your kidney problem, and your partner will be okay because your organs, your sexual dysfunction organs will not be so badly impaired too early. So you may be able to have a fairly good family life. Okay. Understand? And of course, you will not be in a wheelchair with amputation because you have ulcer and you have complication lead to amputation, which is very, very high in that group of people with that particular disease called diabetes. So when you really look at the cost, it is a burden. The factor that many governments look at it, diabetes causes a lot of burden in the healthcare system everywhere in the world, both financially, personally, and financially to the public purse. So education and treatment will help the individual family, individual person, and help the government because of the complications that in terms of finances, but in terms of even supporting if you are diabetic and you are 50 years and you have children in high school or university, you cannot work effectively. You can't give that support because you have to either be in clinic or you have to buy these expensive support system, and the support system mean medication, mean apparatus, which could mean your dialysis, your prosthesis, or other things, or your heart monitor, or things like that. So those are some of the really psychologically too. You realize that you will have these complications, and then when they start, one start, the other sets in laughter, so you just get into a whole depression thereafter, and your quality of life just go right down. Okay. So if you have to try very hard, and in fact, sometimes I had a patient, a professional, person, and when I discuss the diagnosis of having diabetes, and I explain, just as I'm explaining to that young lady and the diagnosis of diabetes, she was frightened. But after 2 weeks, having understood what it means, and she had to stop some of the things that she was doing, when she really looked back, she said, I am not happy at all having diabetes. But doc, it may not be too bad because I realize that if I have a healthy lifestyle modification, yes, and if I follow a lifestyle modification and support, which is purely health, yes, and good for me generally, I'm going to be better off. Okay. And when I realized now that I should stop smoking, because that's what I was doing too, yes, it's going to be good. And you are telling me that smoking and diabetes don't work good. Yeah. I'm into it. Then I said, drinking. Yes, I used to enjoy it. Nice. But no, when you tell me that it's not good and my diabetes is not going to be controlled. When you tell me that I must exercise, I'm very lazy. Yeah. I used to sleep in bed excessively. Now you're telling me I must wake up and do my exercise. You're only going to help me better. And when you tell me I must be happy, all right? And because I have a chronic disease, yeah, I must develop friendship, I must have an attitude, I must then relate to other healthy people with healthy group. Doc, you're telling me the great secret of the success of life. That's what she told me. Although you gave me something which is not nice, I now can use it to my benefit. And what I have said here outlined, if you follow it, this is not a death sentence. It can be used to improve your own quality of life and be an example that with a big challenge you can overcome. Your family can see it too. Your own effort.
Yeah. Alright, now I know that you do like a lot of research with diabetes, right? Research in diabetes. I want to discuss some of the research that you have been doing and how it's contributing to patient care.
Yes. Well, my research and my PhD that I did was using a particular type of exercise and how exercise in a specialized setting could affect persons who have diabetes, and how I could measure this and show how exercise could affect oxidative stress. My publication, of course I did some international publication using special yoga exercise. So it's yoga exercise and how it affects type 2 diabetes. In fact, the publication and my thesis was the molecular mechanism of yoga exercise in the control of type 2 diabetes and its effect on oxidative stress.
Okay.
So it looked at all of these enzymes and so forth, and then we were able to show persons who, one, before and after exercising, and we measure the stress, the oxidative stress enzymes, some which the bad ones, were reduced and the good ones had improved. The free radicals, we looked at those stressors, and we saw just really controlled exercise, how it affects your body. So remember I mentioned exercise having very good control. We were able to measure that, and I did quite a bit of publication on that. Of course, later on I worked with other herbal medicines.
Yes.
I worked in the Ministry of Health some time ago in the medicinal cannabis unit, and I looked at CBD, right, which is has an antioxidant property, and we look at not the usual thing that gets you high, just the properties of oxidative CBD, and how we, how that could affect persons who have diabetes and other illnesses. And we got good results and had some publication in that, which can be researched, and it's there for references and so. So those are what we do. Of course, I support exercise and look at, consulted with other research bodies.
Okay.
I mean, I have been doing an ongoing research with one of the bigger hospitals in Cuba, Hospital Almejidas, that has been going on now for over 20 years, where we look at two sets of people. One, older people who had diabetes and who were engaged with lifestyle modification, and we have been following them for the last 20 years, and compare with a group that did not have exercise, and we are having such fantastic data. From that, we also look at, and we have had to some publication, look at people who are at risk, family risk, and how we could modify these risks, behavioral risks, to prevent the development of diabetes. It's still ongoing, so research for information is always important. As researchers and as doctors, we want to find for our patients what we can advise them.
Okay.
in better controlling their disease processes.
Alright. So any final word for those who are watching? Summarize.
Well, I would want to summarize for if you have diabetes, well, I do hope you would have, learned something from the session to understand all of the paradigms and the perils of the management, and as expert, and you can give your own talk as a testimony if you have it, and if you are in healthcare and just being a curious person, you can still send a message. And the message I would want to leave you. And when I started out, I looked at just these 5 points, and just if you're giving a talk at your church or for your friends, you use these 5 principles. And these 5 principles can help you with all disease process, not only diabetes. That education and instruction is very important for anything, and that will be the start of the management approach of your diabetes. The second thing, of course, diet. Look at your own individual. If you have a problem, look at your food, and you must eat healthy food, fresh fruits and vegetables accordingly will always be good. Drinking good, good juices, of course, water and so forth is going to help you. Exercise is going to be most important. It doesn't matter where you are, who you are, exercise is going to keep you moving healthier and healthier. And fourthly, obviously, you want to just don't say something is working. Get out, find out how it is working, and if it is causing any problem by doing testing. Whatever the testing is, whether blood test, checking your pressure, whatever. If you're doing something, you want to make sure it is working. And fifthly, for some instances, it is number 1 that you must take your medication. Take your medication and just don't stop it unless you have good reasons to stop it or modify it. And speak to somebody who understands and who does not just guess and spell, but why you must change this medication, why you must reduce it, or why you must increase it. Talk to somebody, and if you're not comfortable with the person or don't believe in the person, seek a second advice, but don't stop there. Be an active person in your life. Take control, and if you do this, you'll be rewarded with fulfillment, if not happiness. But a determined life is a life that feels good and that you are in control over what you do and who you are. And that's my closing.
Okay. Well said, Dr. Gordon. So viewers, so if you have learned something from this program today, please remember to share with a friend or colleague. Also to subscribe and like this video to ensure that this community and this project that we're developing continue to be a success, and so that the entire world can actually benefit from medical information, which is essential for healthy life and prosperity. So, Dr. Gordon, thanks very much for coming. Alright, we appreciate it. Alright,
My pleasure.
I learned a lot myself right here today. Alright, so until next time, viewers, keep safe.
Be sure to subscribe for more informative contents on life, sickness, and death.